Listen to me very carefully. What I'm about to tell you could protect your memory, your independence, and your dignity. Or the memory of someone you love. Because dementia doesn't arrive loudly. It doesn't knock on the door and announce itself. It slips in quietly, disguised as normal aging. A little forgetfulness, a little confusion, a little extra sleep. And that's why it's so dangerous. Dementia isn't just one disease. It's a syndrome, a gradual breakdown of memory, thinking, judgment, language, learning, and orientation. And for many people, it becomes the road that leads straight to Alzheimer's disease. Here's what almost no one tells you. The earliest warning signs don't look dramatic. They look ordinary. Sleeping more than usual. Struggling to balance a checkbook that used to be easy. Becoming unusually moody or irritable. Repeating the same story again and again within 10 minutes. Losing keys, misplacing everyday objects, forgetting conversations that just happened. And when those signs start appearing, time matters. That's the moment, not months later, when a neurologist should be involved. But before we go any further, I need to tell you a story, because not every memory slip is dementia, and mislabeling someone can be just as damaging as missing the disease itself. Years ago, a couple came into my office deeply worried. The wife was convinced her husband was developing dementia. She said he was forgetting words, mixing up details, losing track of conversations. So I did something simple. I didn't rush to label him. Instead, I watched them talk. Every time the husband paused, every time he searched for a word, the wife jumped in. "Honey, you forgot again." "No, that's not right. You're mixing it up." "See, this is what I'm talking about." And suddenly, something became very clear. I stopped her gently and said something she wasn't expecting. "You may actually be making this worse." I explained that constant correction can lock mistakes into the brain, especially in older adults. It creates anxiety, pressure, self-doubt. So I asked her to try an experiment. For 1 week, don't correct him. Don't finish his sentences. Don't point out mistakes. Just let him speak. They came back 7 days later, and the change was remarkable. He was clear, articulate, engaged, sharp. No obvious signs of cognitive decline at all. That moment taught me a lesson I've never forgotten. Stress, exhaustion, poor sleep, and pressure can mimic dementia. And misdiagnosing someone, especially someone you love, can quietly steal their confidence, their voice, and their independence. So let's be clear. What is dementia really? In simple terms, it's a progressive decline in mental ability. Often, it involves shrinkage in key brain areas, especially the hippocampus, the region responsible for memory and learning. But here's the key word: progressive. Occasional forgetfulness does not equal dementia. Losing your train of thought when tired does not equal dementia. Forgetting a name under stress does not equal dementia. However, patterns matter. Frequency matters. Progression matters. Here's a simple at-home awareness test. Make a short grocery list, 5 or 6 items. Read it once. Then change the subject. Talk about something else for 5 minutes. After that, casually ask them what was on the list. If most items are gone, not once but repeatedly, that's a sign worth taking seriously. Not to panic, but to pay attention. Because early detection doesn't steal hope. It protects it. And in the next part, I'm going to explain the subtle warning signs most families miss. The brain changes happening silently, and what you can do, starting today, to protect memory for as long as possible. Dementia is a syndrome. It affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. Dementia leads into Alzheimer's, and the beginning symptoms are the person sleeps more, has a bad time balancing their checkbook, becomes very moody, and will repeat the same thing over to you after about 10 minutes. The person also will lose their keys to the car or other objects. The moment you start to see any of these symptoms, you should get that person to a neurologist to do testing on them. What you can do is make a grocery list up, read it off to the person once, and then talk about something else for about 5 minutes at the most. Then ask the person who may have dementia to tell you what was on the grocery list. And if you notice that they are missing a lot of things you wrote down, this could be the beginning of the dementia. But before we dive in, let me share a story from my time helping folks. A reminder that not every memory slip or moment of confusion is what it seems. I remember a couple who came to my office years ago, concerned about what looked like early dementia. As I spoke with the husband, I asked when he first noticed these signs. He paused, then said, "I'm not sure, but I think it was when my wife started telling me I was forgetting things." It struck me as they interacted. The husband would stumble on a word or forget a detail, and his wife would immediately jump in, correcting him, saying, "Honey, you forgot again," or "You're mixing up your words." I had to be honest with her. I explained that constantly pointing out someone's mistakes can actually make things worse, almost solidifying those errors in their mind. So, I asked the wife to try an experiment. For 1 week, just let him make mistakes without correcting him at all. When they returned, the change was remarkable. He was articulate, sharp, and showed no obvious signs of cognitive trouble. This taught me a valuable lesson. Those occasional memory lapses, or moments of confusion we all experience, especially when stressed, tired, or sleep-deprived, don't automatically equal dementia. And misdiagnosing someone, especially a loved one, based on these fleeting moments can be incredibly damaging. So, what exactly is dementia? In simple terms, it's a decline in mental abilities. Often, this involves certain parts of the brain shrinking, particularly a structure called the hippocampus, which we'll touch on later. But here are some of those early, more subtle signs. Keep in mind, experiencing these occasionally doesn't automatically mean dementia, but they're worth paying attention to. Number 1, trouble getting organized and planning. You might find it harder to manage tasks, follow a plan, or keep things in order. Number 2, shifts in personality. Noticeable changes in someone's usual personality can be an early indicator, though again, many things can cause personality shifts. Number 3, surprisingly, constipation. While constipation alone doesn't mean dementia, it can be one of the early signs. Think about the strong connection between your gut and your brain. Your gut is often called your second brain. It has more nerve fibers than your spinal cord, and many cognitive issues can actually have roots in your gut health, the balance of bacteria there. These microbes produce neurotransmitters, even more serotonin than your brain. People with conditions like Alzheimer's and Parkinson's often have a higher rate of constipation. Number 4, sensory changes. This can involve your sense of smell, taste, hearing, eyesight, and even your appetite. Changes in any of these could be early clues of cognitive decline. As this decline progresses, focus, concentration, and overall memory become more noticeably affected. Number 5, language difficulties. This goes beyond just occasionally forgetting a word. It might involve struggling to find the right words, repeating things frequently, or mixing up words. This often relates to the hippocampus. Sometimes, a person might speak fluently, forming complete sentences, but what they're saying doesn't make sense. It can be incredibly frustrating for them as they try to communicate. This is often linked to the shrinking hippocampus. Number 6. Difficulty navigating in new places. Imagine going to a new store and feeling completely lost, unable to find your way even with directions. Our brains have an internal GPS that helps us orient ourselves in space. When this area declines, your internal map malfunctions and you can't figure out where you are. If you consistently struggle with this, it could be an early sign. Now here's the empowering part. There are things you can do to address these early signs and support your brain health, potentially slowing down or even reversing these changes, especially if caught early. The key is to act now, rather than waiting until things become more advanced. One of the biggest oversights in conventional medicine, in my opinion, is the lack of emphasis on the profound impact of diet on brain health. The connection between what you eat and how it affects your brain is huge. While genetics and other factors play a role, your diet is a powerful tool for both preventing and even improving cognitive decline if addressed early enough. Number 1. Address thiamine, vitamin B1 deficiency. One common cause of hippocampus shrinkage is a lack of thiamine. This can happen with excessive alcohol consumption, but also with a high carbohydrate diet, as your body needs more B1 to process carbs. So, reduce alcohol and consider your carb intake. Nutritional yeast is an excellent natural source of B1. Choose the kind that isn't fortified with synthetic vitamins for a more natural approach. Number 2. Fix your gut microbiome. There's fascinating research linking Alzheimer's and Parkinson's to a lack of diversity in gut bacteria and gut inflammation. To improve your gut health, eat a wide variety of vegetables, not just the same ones repeatedly. Fasting can also increase the diversity of your gut microbes. Remember, your gut and brain communicate in both directions through the vagus nerve, and your gut microbes produce important neurotransmitters and B vitamins. Consider a low-carb, grain-free diet, as gluten can worsen cognitive issues for some. Also, be mindful of GMO foods and glyphosate, a herbicide linked to GMOs, as glyphosate can harm your gut bacteria, just like it affects soil microbes. Opt for organic, non-GMO foods whenever possible. Number 3. Embrace sprouts. Research shows that sprouts, like broccoli sprouts with sulforaphane, are incredibly beneficial. Sprouting unlocks a wealth of nutrients in seeds, making them more digestible and bioavailable. Sulforaphane, found in broccoli sprouts, is a superfood for your brain and can be particularly helpful for neurodegenerative conditions. Sprouts are also great for gut health, which is often compromised in Alzheimer's and Parkinson's patients. They're easy and inexpensive to grow yourself, so add them to your salads regularly. Number 4. Utilize ketones. Ketones can bypass damaged brain cells and provide direct fuel to neurons. In conditions like dementia, the brain may struggle to use glucose effectively. Ketones offer an alternative fuel source that can help brain cells thrive. Regular intermittent fasting and periodic prolonged fasting can significantly boost ketone production and upregulate genes that support brain health. Consider incorporating MCT oil, a couple of tablespoons a day, or exogenous ketone supplements into your routine. Number 5. Consider ginkgo biloba. Specific extracts of ginkgo biloba, particularly EGB 761, have shown promising benefits for dementia patients, offering significant neural protection. Number 6. Explore lion's mane mushroom. Research on lion's mane mushroom is truly remarkable for its positive impact on cognitive function. It's not a subtle effect. It can have a significant influence on your brain health. I'll put some more information about this below. Number 7. Follow brain-boosting basics. This includes getting enough omega-3 fatty acids, especially DHA, from fatty fish and fish oil. Cod liver oil is excellent. Vitamin D is crucial, as is zinc. Regular exercise helps increase oxygen flow to your brain and prioritize sleep. Lack of sleep increases stress hormones like cortisol and depletes your brain of oxygen. Want to dive deeper into how to care your brain and protect your cognitive function? Click the video right here. It's my latest guide to brain health, packed with even more actionable steps you can take today. Don't wait. Your brain is your most precious asset.